Hi, today we are going to be talking about assisted suicide, also called physician-assisted suicide or at times euthanasia. This is the process whereby a person ends their life with the assistance or intervention of medical staff, usually by taking a lethal dose of medication, either usually at home in the comfort of their own home. I support assisted suicide for terminally ill people that are suffering. Physician-assisted suicide should be legal for terminally ill people. There's no question about it. In legalizing assisted suicide, you allow terminally ill people to end their suffering. They have the opportunity to end their suffering and bring on that dying process. The government should have no say over what a person can do with their medical choices if they're not hurting anyone else. So there's a few differences between euthanasia and physician-assisted suicide. I'm just going to explain that here. Euthanasia is when a doctor provides the means with which the patient may end his own life, whereas physician-assisted suicide is when the doctor causes the patient's death. For example, through a lethal dose of medication. Dr. Jack Kevorkian describes the difference. He says, I quote, "It's like giving someone a loaded gun. The patient pulls the trigger, not the doctor. If the doctor sets up the needle and the syringe, but lets the patient pull the trigger, or the plunger, that is assisted suicide. If the doctor pushes the plunger, it would be euthanasia." So that's just some background on that. There are deaths with dignity mandated by state law in only 3 states. That's Oregon, Washington, and Vermont. There's a court mandate in 2 states, Montana and New Mexico. States that don't have explicit laws for assisted suicide have very unclear laws. So besides those 5 states we just mentioned, the other states, it doesn't allow assisted suicide, but the background information, the laws, it's just very unclear. So that leaves people in a very difficult position when it comes time to make those decisions. As a nurse, I have seen so much suffering. I have been a nurse for 14 years now, and when it comes to that point when a person is in so much pain that they would rather not face this world, would rather take their own life, that's a really difficult decision. It doesn't come upon lightly, so I don't think we should look at this issue lightly. I've held hands, I've seen family mourn, I've seen the narcotics and the pain medications given with no relief, while people are just in this intractable pain, and that doesn't seem fair. Nobody chooses that. As a granddaughter, I have watched my own grandmother die from cancer, and she had breast cancer. It spread all over her body, and in the end, she begged for death. There was so much suffering, there was so much pain, and she had given up and still needed to suffer through all of that until death came. I believe one reason there is so much stigma around this topic is because of religion. Religion has become entranced in our society, in our laws, and there are many religious beliefs that point to not ending your life. So many people cite religious belief as their objection to assisted suicide. Charles McCann states that this belief is that all life, but particularly human life, is recognized as a direct gift from God, one that never becomes personal property. It is not ours to give away, to damage, or to destroy at will, but to preserve intact until the moment when it is taken back. So this is a belief that many Christians have. that it's not their life to give. So in that, assisted suicide would not be okay because you are taking away a gift from God. McCann further goes on to assert that there is a Christian belief that suffering can be beneficial in its own right. Suffering should be looked at as a positive thing when it is unable to be avoided because it means the entry into something good. So in other words, all of this pain will end and you'll get to go to heaven and everything will be fine. Again, when someone is in intractable pain, when they cannot get a grip, they can't breathe because of their suffering, how do you tell them this suffering is a gift from God? And how do you tell that to a person that doesn't believe the same things as you? When there is relief, they can escape the pain. There is relief. They can't treat the pain, but at that point, if they were to make the decision to end their own life, the pain would end and they would have their suffering end. Ultimately, it should be the patient's choice to end their suffering, not a religious belief that may not even be their own. It's unfair that a person is left to their own beliefs and opinions throughout their lives to make the decisions they see fit regarding their own bodies. Yet at the end of their life, we take that power away from them. One of the most important decisions in their lives, and we tell these people it's out of their control. You've lived your life, you've made your decisions, but at this point, it's out of your control. Given the choice, most people would want to live in old age. They'd want to accomplish what they came along the way. They want to die a satisfying, peaceful death. However, that is not always possible. A person's life can be affected by severe disability, incurable disease, and may come to a conclusion in a slow and agonizing death. I ask you too to look at patients who stop treatment as a means to end their suffering. A person that's on dialysis and needs dialysis every 2 days, 3 days at max in order to survive. I myself have personally dealt with patients like this that come to their breaking point, they're done, and they decide to withhold treatment to end their lives, or patients who stop eating to end their lives, or stop taking their medications. These are more passive ways to end your life instead of taking a lethal dose of medication, but it's nonetheless taking that power back and making that decision that you've had enough and that you're going to die on your terms. We don't penalize those people. We don't fault those people for doing that. That was their decision to make. In conclusion, I understand the hesitation people may feel towards this issue. But the bottom line is that we need to have a conversation about this. We need to get more comfortable with the dying process. We need to see that people deserve to make these decisions themselves when it comes time. And if assisted suicide or euthanasia is legalized, there will be strong stipulations around it. It will be a highly regulated option for people, but an option nonetheless. An option that someone could take after all their options have been exhausted. After careful discussion with their family and their physician, an option that they have come to, not someone else. The bottom line is that we all deserve the right to determine our healthcare decisions, including the decision to end your suffering and in turn, take your life.